Hi, is it okay to come in? Excellent. Hi, how are you doing? Great. I'm Dr. Angel. A lot of my patients call me Dr. A. And what would you prefer me to call you? Excellent. Pleasure to meet you. Boom. So, I understand you were referred to us by... Yes, they are lovely. I will be thanking them for referring you. They said what? Oh, that's so kind. Yes, that is our office's policy. We try to make it as homey as humanly possible while still maintaining a sterile environment. But I do find it cuts down on a lot of people's anxieties and worries and that dreaded white coat syndrome. So if you're okay, we can begin. Okay, so what brings you here? It's just the meet and greet and checkup? Okay, no issues, a few headaches, okay. Have you had headaches in the past? All right. Are they at a regular time of day? Are they, okay. Anything changed in your life? Anything new at home? Any new products? Even perfumes, colognes, anything like that? What about at work? A new boss. Yeah, that could do it. Okay. Not saying that's it for sure, but we'll definitely run a brief neurological exam today, and I'll send you for some blood work. Are you good with that? Okay. So how this works is I'll do the exam. I will not do anything without telling you what I'm doing first. Okay? Okay. And I understand everything's up to date except for flu shot, and you gave your consent to get that today. Okay, we'll be doing that at the very end, unless you worry about it. You're okay? Okay. Some patients worry, and I'll do it right at the beginning to get it out of the way. Okay, no, I want my patients as comfortable as humanly possible, okay? Speaking of which, I did read that you asked us not to wear masks, and we have no problems with that, unless you are coming in for an active illness. In that case, until we know what we're dealing with, you are required to wear a mask as well as we are. Are you good with that? Okay then, that's perfect. Yeah, it's just for everyone's safety. Yeah. Okay, so we're going to begin. Okay. I'm first going to just do a brief examination of your glands. So what I'm going to do is start at your temples. I'm going to work my way down, feeling, rubbing like this, go to under here. I'm going to do your neck and across to your shoulders. Are you okay with that? Okay. All right, I'm going to begin then. Let me just warm up my hands, even though it's quite warm in this room. Okay. So I'm just going to begin at your temples. I'm just feeling for any swollen glands or lymph nodes. Okay. Coming down to under your chin. Good. Excellent. Okay, your neck and your shoulders. Okay. Was any of that painful? No? Excellent. I'm just going to make my notes, and then we'll transcribe them into your chart. Okay. Now, the next thing we'll do... Oh, your temperature. I know the nurse did it and it was a little high, but considering how hot it is outside, I told her let me try it because it wasn't high enough to really be considered a temperature. Perfectly normal. Okay. That's great. And this machine I turn on, and I'm going to put it on your index finger like this, and it will tell me what your oxygen saturation level is. Mine is 93. How? 96 now. I'm wearing a glove, so I was getting a little concerned. All right, let me just sterilize it, even though I'm wearing a glove. You'll notice our times together may take a little longer because even though all the equipment is sterilized, I insist on sterilizing as we go. Okay, so finger. Excellent, better than mine. Okay. And next we're going to do your blood pressure. Well, before I do that, let me check your heart. Okay? And the way I'm going to do that is I'm going to ask you to either lift your shirt or pull it down, whatever makes you more comfortable. And I'll listen to your heart. I'll ask you to take a deep breath and hold it just for a couple seconds and then let it go. And then we'll come around the back and you can lift your shirt if that's okay with you. And I'll listen to your back and we'll do the same. Take a deep breath in. Is that okay with you? Okay. Do you want to? Okay. Thank you. Hold. Release. Deep breath in. Hold. Release. Okay, one more. Excellent. Okay, I'm just going to go around to the back. Can you lift? Thank you. And deep breath in. Hold. Release. To this side. Deep breath in. Hold. Release. Excellent. Excellent. Very good. Oh, I should leave this in because we're going to do your blood pressure. So, how we do this, I will put this around your upper arm and take a reading. And I'll be using my stethoscope. So try to breathe normally, try to relax, think of something else. Okay, this arm, thank you. Okay, and I'm just gonna pump it up and listen, okay? Are you ready? Okay. Okay, all right. Now, that was a little bit high, very little high, but enough that the next time you come in, if it's still a high reading, this is our first meeting, it's hot out, it's a little nerve-wracking, I know, to meet a doctor for the first time, and yeah, so let's just wait till our next appointment when you come in to get the results from your blood test. And if it's still high, I'm going to put you on a machine that does 5 readings. It gives me the average and it lets us know if it is just white coat syndrome or if there's something we need to be looking at. Okay? Yeah, pardon? I'm just going to make my notes. Okay. Let me just write that down here. What? Sure, you can have your phone on when you're doing it. Anything that helps you to relax. You listen to what now? I love ASMR. I actually do follow quite a few people and I've referred patients over to them. It helps to relax, of course, including people who are suffering with insomnia. Yep. Who's your favorite artist, ASMR artist? I love her. Yes, I follow her too. She's like everyone's favorite aunt. Oh, I know. Yep. Oh, they're great too. Yeah. I love the facial one that she does. Yeah. Very good. Yeah, the Reiki ones are great too. Oh, excellent. Okay, so you're already ahead of the game about knowing how to help yourself to relax and everything. Okay, so let's do a brief little neurological exam. So I'm going to do your reflexes first. And I'll check your knees, your elbows, and your shoulders. Okay? And then I'm going to get you to stand up and do just a few neurological exercises. Don't worry, they're not difficult. And then I'll do some follow the lights type thing. Okay? All right. You're good with all of this? Excellent. Okay, so we're going to do your knee first. So, ready? Okay. The other leg. Okay, and can you do this with your elbows? Okay. Okay, and I want to do this side now. Good. Now I'm just going to do your shoulders. Good. I'm going to do this one. Good. Now, can you cross one leg over the other? Thank you. Good. And can you reverse it, please? Very good. Now, I'd like you to get off the bench. I'll give you my arm. There you go. Excellent. Now, I want you to do, I'm going to show you some exercises to do. And please don't worry that I'm intently staring at you. I'm just looking for some reaction, okay? So the first one you're going to do is this. And you're going to do that 3 times with your eyes open, and then 3 times with your eyes closed. Are you ready? Okay, begin. 2. Very good. Now with your eyes closed, please. Very good. Now, can you bring your fingers together with your eyes open and closed? And closed? Very good. Now, can you put your hands out like this? And with your eyes closed, just stay like that for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. Now, can you push against my hands as hard as you can? Would you prefer gloves? No, that's fine. Okay. Push against them as hard as you can, please. Oh, very good. Okay. Now, put your hands like this. All right. I'm going to put my hands on top, and I want you to push them to the ceiling. Push them to the ceiling. Push. Oh, excellent. Excellent. Now I'm going to put my hands like this. You put your hands on top, and I want you to press them down. Oh, excellent. You're doing very well. Now, I'm going to give you these 2 fingers, and I want you to squeeze them, okay, as hard as you can. Okay. Now, reverse your hands and do it to my fingers. No, reverse. That's it. Yeah. Very good. Excellent. That was great. Well done. Okay. Let me just make my notations. I hate putting my back to a patient. No, so far everything's looking great. It really is. I don't believe in keeping secrets from patients. That's why whenever you come into a room, your chart will already be in here. You can look at, you can't remove anything, but feel free. Those are your information. Yeah. The only thing we don't is a referral is if we referred you to another doctor and they send it over, then you have to give consent to them for us to let you see it. No, generally when I send the referral, I send a consent as well. We don't always get it back, unfortunately. Okay, that is great. Now I'm just gonna do my light, and what I want you to do is just follow it, okay? And I'm not gonna do any tricks or anything. Ready? Good. Up, and back, and down. Side, to the other side. Good. And I'm just going up, down, the middle, just your eyes, not your head. That's it. Excellent. Okay, and can you open your mouth and stick out your tongue? Excellent. Excellent. Now, when was the last vision test you had? Because that's another thing that could explain your headaches. Are you due for one soon? Okay. Are you covered with insurance? Okay. I realize that some people's medical assistance depends on what their insurance covers. And yeah, I'm not one of those doctors that says that shouldn't indicate your, no, I understand that and I work within it. So I would suggest getting your vision checked just to see if that's what's causing the headaches. I do have a feeling that it is your new boss coming into play. Yeah, but this is what I want you to do. If they get any worse, if they increase in frequency or intensity, I want you to call my office and I want to get you in here, okay? I don't mess around with headaches. I don't see anything. I am going to send you for a CAT scan, all right? And the problem is they can take, 6 to 9 weeks before I can get you in. But If they increase, I can push to get you in sooner. Okay. Yeah, right now it's not an urgent one. Okay, great, excellent. Okay, and I'm just gonna go wash my hands. Oh, bless me. Okay, sorry about that. All right, and the other thing, I just want to go over some things with you. Now, do you have these at home, your COVID test kits? No, it's not all over yet, but I do like to make sure everybody has a set of test kits just in case they need them. You can get them from my receptionist. They're free. No, anything to make your life easy. That's what I'm looking for. And then, now this is, I know you're not 50, but this is just to show you some vitamins. Are you taking a supplement? Okay. I do recommend a supplement, especially for people as busy as you are. I don't recommend all kinds of supplements. A one a day is fine. Unless your blood tests show you're short on something, you don't need to go out and buy B2, D3, magnesium, CQ10, omega-3, ginkgo biloba, evening primrose oil, you know, all of one supplement will be fine. If you see a naturopath, that's fine. Follow what they say as well. I love when people combine Western medicine with naturopaths. It works very well together. We're made to complement each other. Of course, it's my pleasure. Okay, now, is there anything that you needed to discuss? Your asthma medication. Okay. You don't find your inhaler works very often. What kind of inhaler do you have? Okay, I think I know the problem, but I can get you a chamber. This is just a test one that I show people. So what it is you put it on, you put your inhaler in here, then the medicine is in here. So it's not shooting to the roof of your mouth, because sometimes when you use an inhaler, you automatically do this. And then you breathe it in and you get all of the medication. The other thing that I can prescribe for you, let me see if I have a sample one. I know I have one here. No, I don't. Is an intubulator. It looks like this, and the top is actually designed to look like a sippy cup, for lack of a better description. Oh, that looked bad, but you breathe it in, and the medication goes down. The biggest thing, you click it, make sure you're clear. A lot of people don't do this. You have to get your lungs out, click it, and then breathe it in. And just hold it in there for a couple seconds so that it gets into your lungs. Okay, would you like me to prescribe either the chamber or the intubulator? Both? Oh, you just filled your inhaler. Waste not, want not, that's what, yep. Okay, so I'm making a note, and I'll go on my computer and send that out. So when you go to reception, they're gonna book you for the CAT scan for your next appointment to get your blood test results that you had done earlier. And you can pick up your prescription. Exactly. Oh, did you think I forgot your flu vaccine? Which side do you sleep on? Okay, let's do the other side then. It does sting for a bit. Yeah. Okay, can you roll up your sleeve? Okay, I'm just gonna clean. And I've got my needle right here. Are you can see the needle or no? No? Okay. Okay. Okay, look at me. 1, 2, 3, pinch. And done. That's it. Your appointment's over. It was a pleasure to meet you. No, anytime. You have the office's number. I have a nurse practitioner that works with me. And if I'm not in, you can ask for her. Her name is Natalie. And either one of us would be happy to answer any questions you have. Oh, that's very kind of you to say. I'm very pleased that you're here. Thank you so much. It's been a pleasure. Let me show you out. You can exit this way. Come on.